So let's get started. My name, for those of you who don't know me, is Christina Hildebrand, and I'm the founder and president of A Voice for Choice Advocacy. We educate and advocate for informed choice and transparency of what goes into your body, be it food, air, water, pharmaceuticals, all sorts of things. Basically, we want you to know what's in a product and give you the choice of whether you put that in, but to really make an informed decision. So, as I said, for everyone on the call, welcome. Thank you for coming. We did one of these in December, and we had over 400 people sign up and about 200 people in the end on the call. So it was definitely needed, but I'm happy to go through more questions, and I'm happy to repeat questions if somebody didn't see that. You can see the recording on our YouTube channel and our BitChute channel. So first question, the school my child attends requires frequent COVID testing of staff members, whether they have symptoms or not. If they decide to require this of students, is there a way to opt your child out of this? The answer to this is probably not. And I will say, if your children go to public school, there is funding that is tied to COVID testing. So the governor came out with a school reopening plan that gets public schools open in February for the lower grades, and then starts opening the rest of the schools throughout California up until high school. And in that reopening plan, he has $2 billion set aside. But in order to get the money, you have to do testing of your students and the staff. So it's going to happen. Part of that, I think, is that they need to have the number of tests, because part of the tier reopening plan is based on number of tests. And so this way, if you have children testing and staff testing, it automatically increases those numbers. So the counties are also going to be putting pressure on doing testing. I don't see a legal way out of this, because it's not a medical treatment, it's part of public health. It is non-invasive, so to speak. Most schools will use the nasal swab test, so not the one that goes up to your brain, but the one that's just in your nose. My recommendation, or our recommendation, is to use the saliva test. And the reason why, for our organization, I emailed somebody this today, we prefer output than input. So we prefer things coming out of your body rather than going into your body. And so in this sense, it's, rather than having something shoved up your nose or a child's nose, to be able to have a saliva test where you're just spitting into a tube. That gives you more control of it. The tests are pretty much the same PCR-wise. We can argue whether that's effective or not, whether testing is effective or not. But to this point, this question, I don't see a way out. What I would recommend is to advise your school, or to try and get your school to use the saliva testing. There is a company called Saliva Clear that is using the Yale test, and they do mass school testing. And basically your kids get a tube, they spit in it, they hand it over, and they, it gets sent in and then goes from there. The other thing that I will say is, I would highly recommend that anybody who has a positive test goes immediately and gets a negative, or gets another test, because the likelihood of false positives with PCR tests is extremely high. And so if you do get a positive test, go immediately and get another test to see whether it truly is positive or not. That was that question. Next question. Will children be required to have the COVID vaccine in order to attend school? So the answer to that is we don't know. At this point, it's unlikely, because the COVID vaccines have not been tested on children under 15 years old. And so there are no clinical trials. There's nothing on children under 15 years old. And so it is unlikely. I wouldn't expect it to be required of children until the end of those clinical trials. They are somewhat more, or they're less likely to have an emergency use COVID vaccine for children based on less data. It seems that the people at the FDA, the people at ACIP are less willing to take shortcuts on children. So hopefully that's true, in which case there likely won't be a COVID vaccine for children for another year or more. So I don't see that happening. Even if it does happen here in California, it would have to be passed by the legislature. And that means that it could only have a medical exemption, not a personal belief or religious exemption. If it's added by CDPH or another health or the local health officer, it would have to have a personal belief exemption tied to it, because they cannot add to the child schedule at school without having a personal belief exemption tied to it. So if that happens, you do have a way out. So that's that question. Next question. I'm in California and I'm considering using a religious exemption. I am a practicing Catholic. The United States Council of Bishops and the Vatican have made it clear that the Church promotes the COVID vaccine and they do not object any type of religious doctrine to contradict it. How would I get around making a religious exemption letter to my school district employer when my religion has made it clear I should get the vaccine and there is no reason to morally object it? I'm already thinking ahead of answers to questions that would need evidence and that could be made against me by my employer to see I am being truthful about my potential religious exemption. So this is something that each person's religion is their own, and per our First Amendment and legal cases cannot be judged by another person. So I don't have to be part of a formal religion in order to be religious. So I don't have to be a Catholic, I don't have to be a Jew, I don't have to be a Muslim in order to be religious, and nobody in the United States can judge me from my religion. And so the fact that you are Catholic, you can still have different practices from the Catholic religion. There are lots of Catholics that have, that takes different parts of Catholicism, and the same is true for every religion. You don't follow it exactly, everyone doesn't follow exactly the same religion, so to speak. And so there are various texts in the Bible that prohibit, or that would say, you shouldn't take a vaccine. But the key piece of this is you have to show that it is a sincere religious belief. So sincere and religious are the two key pieces. So you have to believe it internally through and through, and it can't be a personal belief or a moral belief or an ethical belief. So just saying, I don't want a vaccine in my body, I don't want the toxins in my body, that's not a religious belief. A religion has something to do with a higher spiritual power, be that God or be it something else, but it has to be something beyond you that is telling you that you shouldn't get vaccinated. And so those are the two key pieces. It has to be sincere, and it has to be a religious belief, not a personal belief or a medical or an ethical moral belief. So hopefully that answers your question. If you do want help with religious exemptions, I am happy to help. So I have a lot of people that come to me and say, can you help me create a religious exemption? What I ask is that you send me your employer's policy. So some of them have very specific questions. Some of them just ask for a letter stating your beliefs, and also what your religious beliefs are. So, everybody, as I said, has different beliefs, and you have to tailor it to your beliefs, not to my beliefs or to what I want to, or what I could make up. So we'll go to the next question. I've heard rumors of the vaccination eventually being required for travel and even to enter a grocery store. Is there a validity to that claim? So I've been saying this for months now, since I think it was July, that I don't think the vaccinations will be required or mandated by the state or by they can't really be mandated by the federal government, but they can be required by the state. I don't think that'll happen. I think it will be a social mandate, and that will include things like travel, going into grocery stores, going into getting your driver's license, those types of things. Do I think that's likely? I think it really depends on how widely the vaccine is taken up, and how soon COVID is halted, so to speak. I think the fact that a lot of people are rejecting the vaccine means there's a lot more uproar. So, those of us who have been in the vaccine truth movement for years, this is a huge, I call it the silver lining of COVID, because we have so many more people that are questioning the vaccine that that never would have before. And so I think the more people, and it's why we really need to talk to people and talk to everyone about this vaccine and the issues with the vaccine, because I think the more people that reject it, the less likely it is to be required for travel or grocery stores and that type of thing. And I think also, you know, if the numbers go down, I personally don't think the vaccine is going to make the numbers down. I think go down. I posted something a few weeks ago saying, I think it's going to be a change in definition of COVID. I think we're going to see more restrictive PCR test cycles. So they're going to come down. And so we have less false positives, less people being asymptomatic positive, and that they are going to change the definition of, for example, a lot of people this year have died with COVID, not from COVID. And so between the three of those, it's similar to what they did after the polio vaccination. They changed the definition of polio. They will change the definition, so to speak, of COVID. And so the number of people with COVID will go down dramatically, and they will say it's the vaccine, but it will be for other reasons. Hopefully that answered that question. Next question. Are there any grounds of getting a medical exemption if your child has an anaphylactic reaction to nuts? Child also has a neuroblastoma, eczema, and medical allergies. So I'm assuming you're talking about California. In California, it is incredibly hard to get a medical exemption. The biggest piece of it is there are no doctors that are willing to write medical exemptions. So it's not even that the reasons are the right reasons. There are just very, very few doctors that will write medical exemptions. An anaphylactic reaction to nuts, no, because, and I'm assuming you're talking about childhood vaccines. For the COVID vaccine, there may be, because, for example, the UK has said if you have an anaphylactic reactions to anything, you should be wary of getting the 2 mRNA vaccines. And so, and there's caution to a lesser extent here in the US. So if it's the COVID vaccine, there may be. For just regular childhood vaccines for school, that is not a good enough reason, because there aren't any nuts that are included in the vaccine ingredient list. As for your other issues, eczema, medical allergies, if there's an allergy to something, an ingredient in the vaccine, possibly, yes. The tough thing is starting this year, starting January 1st this year, the reasons have to be the precautions or contraindications that the CDC has, or a doctor can use their own judgment, but it's likely to be brought up for review if they do that, and no doctor is willing to do that. All right, next question. Thank you. My daughter will be attending university this fall. Can we set ourselves up for religious exemptions now? How else can we prepare for exemptions? So it really depends what university you're going to. UC, University of California, and California State University, they both require vaccines, and they don't have a religious exemption for the regular vaccines. They have religious exemptions for the flu vaccine, and most likely will for the COVID vaccine. What you need to do is just find out the policy when you're applying, find out the vaccination policy and what exemptions they have. If they have a religious exemption, then yes, put it together, but they're not actually required to submit it until either the first day of school or even after the first day of school. We know UC people, they basically have to have it by the end of their first semester, or they're not allowed to register for second semester classes. Next question. Hi, my child is now in 7th grade with an ME written both in 2012 and then 2020. What does this mean for 8th grade? Is she now grandfathered in, or what happens from this point on? Yes, she is grandfathered in until the end of 12th grade. So assuming, the only assumption there is that her doctor is not put on probation. If her doctor is put on probation or suspended, then her medical exemption becomes null and void. Okay, next question. Why has Mrna refused to release the ingredient of their COVID vaccine? How can they do that? They haven't actually, you can go on the FDA site and you can find the ingredients to both the Mrna vaccine and the Pfizer vaccine. They have the whole list there. They have it's a EUA, the emergency use authorization statement, that has all the ingredients. It's like a package insert, basically. So you can find that. I live in California, but work in Nevada. I work for a federal grant-funded program at the state-funded college. My boss today mentioned that we are included in the Tier 2 vaccination schedule and asked if we wanted the COVID vaccine. It doesn't seem mandatory at this point, but it seems like it is headed in that direction. Will this vaccine be required for government workers, and how do we decline? So the first thing that I recommend to everyone is to decline the vaccine, just to say no. If you are then required to get it, you can use a religious exemption. So by federal law, you have to be able to use a religious exemption, otherwise it's discrimination, religious discrimination. So if you get to that point and you need help with that, definitely let me know. Next question. 2 questions. The religious exemption is just for employment and not for schools. Is this correct? Second question is, what are the states that are most friendly to vaccine exemptions? So the first question, yes, the religious exemption in California is just for employment. We don't know about schools at this point. So there are universities, the University of California and a California State University, that for the flu vaccine, they accepted a religious exemption. They don't for other vaccines. And so we are expecting that there will be a religious exemption for the students. The key there is when you have a differentiating, when you have faculty and staff that have a religious exemption, it's hard to then mandate students to have it, because that would count as discrimination. And so we argued that point along with other organizations, and we actually got the religious exemption added for students in colleges. For schools, as I said, I don't think we're going to have a school vaccine mandate for COVID for at least a year. And then what are the states that are most friendly to vaccine exemptions? So we went through this a little bit in our last Q&A, but my recommendation, and unfortunately it is a partisan issue, people will say, well, it's vaccines, it shouldn't be partisan. I agree completely. And I actually am saddened by the Democrats not recognizing my body, my choice, because that's what they stand for, and for bodily autonomy. So my recommendation is to go to a state that has at least 2 parts of their legislature be Republican. So when I say 2 parts, it's 2 parts out of 3. There's a state house, we're here in California, we have Assembly and Senate. They're called different things in different states. So you have 2 state houses, and then the governor. And so you want 2 out of those 3 to be Republican. The other thing that I would look at is what states, and if you go to NVIC, the National Vaccine Information Center Advocacy platform, they have an amazing tool that shows you all the legislation that's ever been brought forward, whether it's passed or not, that relates to vaccination. And on there, you can see which states are most active and with legislation. And there are some states, like for example, Arizona, that while it has a lot of legislation going against vaccines, it also has legislation that, or going against exemptions, it also has legislation that's sort of sharing vaccine truth, like labeling ingredients and stuff like that. But a state like Arizona is you're going to go there and you're going to fight like you did in California. Same with places like Colorado. They have beaten the exemption legislation 2-3 years in a row, but it keeps coming back. And so if you want to go to a state where you're still fighting, then feel free to. But my recommendation is to look at states that have not brought up the vaccine issue, or that they brought it up like in 2015 and it kind of went away. So those are the states to look at. And people say, well, what state would you go to? And my answer is, there are so many other things outside of vaccination. So you can choose the vaccinations, the states that are more friendly to vaccine exemptions. But at the same time, there's so much more than that. There's lifestyle, there's culture, there's, whether you want to be in a town, in a city, in a suburbs, whether, all of those types of things, whether you want climate. If you're going north, you're going to get snow. If you're going south, you're going to get humidity. So there are all those things that people need to take into consideration, which are more of a personal choice. Okay, next one. Does an IFSP count as an immunization exemption for a public school? The school won't sign the current IEP if I don't have an up-to-date immunization to register and my child is not immunized at all. So an IFSP is the equivalent of an IEP. An IEP is an individualized education plan, which is a special needs, basically for special needs children in public school or in elementary school and high school. But it is the IFSP is done by a regional center and is for preschool. So this person is asking what they're saying is the IFSP is for preschool once you get, or sorry, it's for preschool. It's for 3 and below, for daycare and those types of things. And then once you get to 3 years old, you go into the school district and you can get an IEP from the school district. It's actually illegal for the school district to to say they won't sign the current IEP if you don't have your vaccine schedule. So the key here is they have to evaluate you for an IEP. They can create an IEP without you being, as long as you live in the school district, without you being registered. And once you get the IEP, you should be registered. I am not the expert on this. I will completely admit that. And my recommendation, we work with a wonderful organization called Advocate, and they deal with this issue day in and day out, and they're amazing people. And so if you have an issue with the IEP and with your school district, please contact them. If you look up educateadvocateca.com is their website, and they are just amazing. Can you provide tips on how to stop 5G cell towers from being installed in our neighborhood? There are quite a few organizations that work on this issue specifically. Trust, Environmental Health Trust.org, ehtrust.org has a huge amount of information on safer technology and on that type of thing. I'm trying to think, there are some other organizations, but there are a bunch of organizations that do it locally and that tell you how to do it, how to do it locally. So definitely, we're not the experts there, but I would recommend the Trust, Environmental Health Trust is my go-to for EMF issues and 5G issues. COVID vaccine. Apparently, the governor of New York passed COVID vaccine mandate legislation. What can be done now to prevent that happening in California? So it has not passed in New York. There is a bill, and there's a funny side story to the bill, which is the person who introduced, the legislator who introduced the bill, Loventhal, she's from Manhattan, and she introduced 2 years ago, she introduced a menstrual product labeling bill, which we copied last year, and a Voice for Choice Advocacy got that bill authored, and it was signed by the governor and got passed. And so during that bill, you know, I was watching her tweets and her social media, and she was all about, you know, informed choice and, you know, bodily autonomy, that kind of thing. And so I was very surprised that she was the one that actually brought forward this COVID vaccine mandate bill. The legislation, the language of the bill in New York, it basically says that the local health officer can require COVID vaccination if they see fit. That legislation already exists in California. We have a law, AB 262, which was passed in 2019, that says that local health officers have the authority to take any action they deem necessary in an epidemic, not even a pandemic. An epidemic is 3 or more people. And even in a time of, I don't remember the exact wording, but basically imminent, you know, epidemic. So we already have that legislation here in California. If our local health officers are county officers, if they deemed that mandating the COVID vaccine was what they deemed necessary for public health, they could do that. So it's the answer is it doesn't need to happen in California because it already is, unfortunately, or it already could. Okay, next question. How will the Pfizer vaccine qualify for biological licensure if they have given their placebo group the vaccine in March? So the issue is they shouldn't really, but the real issue, or the real concept, is that they're giving their placebo group as they become available. So it's not that the whole of their placebo group will get the vaccine in March, because the whole of the US population won't be eligible to get the vaccine in March. So what they're saying is, for example, right now, if there are healthcare workers in their placebo group, that those people, because they are priority right now and could be getting the vaccine if they weren't in the placebo group, that those people become eligible as they become the priority. So they're kind of rolling people out of the placebo group. from a healthcare perspective, for example, or healthcare worker perspective, for example, those people are pretty much all ages. And if you remove them from the placebo group, you're removing a section, but you're probably removing people that are of a similar age group, and you've got enough people that are that age group still. Where it becomes an issue is, for example, for elderly. So both trials don't have a lot of elderly people in them. It's about 4 to 6%. So if you remove all the elderly people from the placebo group because they want the vaccine, you then are left with no one in that group. And so that becomes the real issue. I think the FDA will make an exception and will say, well, you know, we looked at the clinical trials. It's called a crossover study. So it was against placebo versus vaccine control group. Now we're just looking at the vaccine control group and seeing if they, you know, compared to the people who were in the placebo previously or who are still in the placebo, that they are, you know, basically that they are the same. Is it allowed? It's not the gold standard, but nothing with biologics and vaccines is the gold standard. So I think they, you know, I don't think it will be an ideal case. Will they be allowed to do it? I do think they will, because it will be, you know, an amazing feat to have vaccinated all these people. What's the Pfizer placebo? I cannot find what the Pfizer placebo is. There is nowhere that I've been able to find. I've emailed Pfizer to ask them. In some places, but it's only in news articles, it says it is a saline solution, but I haven't seen it anywhere in the clinical trials. If you go to clinicaltrials.gov, it just says it's a placebo. It does not say that it's a saline placebo. And interestingly enough, it said saline to begin with, and then they changed it and made it just placebo. So it seemed, you know, I don't know why they would have done that if they had kept it as a saline placebo. And then the last one is, do the mRNA vaccines have an adjuvant? So they don't have an adjuvant in the same way as a regular vaccine. They don't have aluminum or anything like that. They work differently. So they have nanoparticles, and they have a fat soluble outer casing. So but they don't have an adjuvant as in a aluminum or one of those types of adjuvant. Interestingly enough, I was, just as a side conversation, I was watching a live stream this morning called Focus on Fauci, and Dr. Martin on that was saying that we shouldn't actually be calling these vaccines, because they are not vaccines. They do not do what a vaccine does. They are they basically put and create a pathogen in your body. And so it's interesting. It was interesting listening to him. If you have a chance, it's towards the end in the discussion piece of it. It's called Focus on Fauci. It's lineinthesand.us is the website for that. But it's towards the end during their roundtable and their discussion. But it's really interesting discussion of how this is not a vaccine, because it doesn't use vaccine technology. It uses this completely new technology. And we've been seeing that over the years. If you look, prior to COVID, there were about 280 vaccines in development, and the majority of them were not what we consider prophylactic vaccines. They were treatments for things rather than vaccines, which are supposed to be prophylactic. All right, next question. What are the most serious side effects we have seen from the COVID vaccine so far? It is hard to say. So, I'll say the ones that have been publicized and the ones that have been made public are Bell's palsy, which is a paralysis of half of your face, is one of them. If you have taken Botox, and this has not been, I haven't seen this actually mentioned anywhere, but it was mentioned in the FDA emergency use authorization meeting. If you've taken Botox, where you've taken Botox, there were people that had incredible swelling of their face or of their lips or of their, you know, structural, facial structure, where they've had Botox. And other than that, anaphylactic reactions. So people have fainted, have had an anaphylactic shock. We don't know of anyone that has specifically died from the vaccine. And I say that hesitantly because I was trying to get the right wording, but there are people that have died following the vaccine. They have, in the clinical trials, for example, I think it was Moderna's, had 6 people die in the vaccine group and 7 people die in the placebo group, and their placebo was saline solution. And so they were considered, all of those were considered not from the vaccine or the placebo. They were just natural causes of death. There are mentions that there have been deaths from the vaccine, but there haven't been any that have been sort of said that there was, shown to be an actual causation from the vaccine, even if they've happened, a day or two after the person got the vaccine. So I would say known reactions are anaphylactic shock, Bell's palsy, this Botox reaction. Clearly, it's having a reaction with the Botox. And there are a huge number of people that have reactions, what they call sort of systemic normal reactions, which are in the first 2 days after getting the vaccine, and it's worse after the second dose of getting, fever, sort of basically COVID symptoms, and just feeling like that you've had a hangover for 2 days, or you just feel like you've got the flu for 2 days. So there are a lot of those reactions, but the FDA, the ACIP, and the manufacturers are saying, oh, those are just normal. That just shows that your body's reacting to the vaccine and it's working well. I question what else is doing to your body. If you're having that reaction to the vaccine, what else is happening to your immune system and your autoimmune system? Okay, next question. What is the best way out of mask or vaccine mandates in the workplace for those of us not in the medical field, but see these coming soon back into the office? I'll take those two separately. I'm going to start with the vaccine mandates, which I kind of got into. I would decline the vaccine, and then I would, if they require it, I would go with a religious exemption. For the mask issue, again, I treat the mask similar to the testing. It's sort of in the between the mask and the vaccine and the testing piece of it. I think unless you have a medical exemption, you're unlikely to get out of the mask requirement. And even with a medical exemption, I think they will tell you to stay home, find other accommodations, for you that don't require you to be in the office. And so the one thing I will recommend is, if you have to wear a mask, and I do this even if I go into the grocery store, because they won't let you in, is to go with a true 47, TRU 47 silver mesh mask. And they are made out of silver mesh. They're two layers of silver mesh. But the silver, the biggest issue with a mask for me is that I'm breathing, when I wear a regular mask, is I'm breathing back in what I've just breathed out. And the silver, being antimicrobial, it kills basically anything you breathe out, and so you're not breathing it back in. It's also very fine that you can breathe through it. So my recommendation for anyone who has issues with breathing or concerns with mask is to get a true 47 mask, TRU 47 mask. And I think I just did a huge order with them and we wiped out their stock, but I probably will do another order, a wholesale order, through a Voice for Choice Advocacy again in the next few weeks. So if you're not on our mailing list, definitely get on our mailing list, because you will get emails about that. We only send out important emails. We don't send out too many emails, but if you want to get on that, it's a voiceforchoiceadvocacy.org, and then a newsletter will, contact form will pop up when you go there. Okay, next question. If I ask for and am granted a religious vaccine exemption at a job and then change jobs, do I have to ask again at my new job? Yes, so that goes from, your religious exemption is specific to your job. You have to apply for a new religious exemption at each job you go to. Yes. Next question. Since the vaccine makers have been immune from liability since 1984, it's actually 1986, why is it necessary for them to request that they be immune from liability for the coronavirus vaccine? Good question. So the 1986 Act is just for childhood vaccinations. So any vaccine on the childhood schedule is immune from liability. The vaccine manufacturers and the doctors giving the vaccine are immune from liability, but it is only those childhood vaccines. Having said that, vaccines that are both on the child schedule and the adult schedule, for example, the flu vaccine, for the flu vaccine, adults can go to the vaccine compensation program and apply for compensation there, and they don't have liability even among adults there. It is the reason why we see, when we see vaccine lawsuits, we see lawsuits among the, for example, the shingles vaccine has a lawsuit or a bunch of lawsuits pending. And so because that's an adult vaccine, it is not immune from liability. The COVID vaccine is an adult vaccine, so it wouldn't be covered under the 1986 compensation program. It is actually covered under the PrEP Act, which is the Emergency Preparedness Act. And under that, and they are immune from liability, and there is a separate compensation program for that is not the vaccine compensation program. So the National Vaccine Compensation Program is just for the childhood vaccines. Next questions. What are some ingredients in the COVID vaccine that are concerning? Thimerosal, MSG, preservatives, etc. So in the mRNA vaccines, which is the one that we have the ingredients for, the Moderna and the Pfizer one, for the other ones that have not been emergency use authorization approved, we don't know their ingredients. But for those two, the key ingredient that most people are reacting to is the PEG, which is a glycol antifreeze, and that is thought to be the piece of the vaccine that people are reacting to. So, and other than that, most of what's in the vaccine are chemical compounds, so to speak, that they're not things that people would necessarily react to. So the PEG, the PEG, is what's most likely to be the reaction. Okay, next question. I know 2 people who have received the Pfizer vaccine. One of them is sick with COVID right now, and the other suspects he may have caught the virus, but is asymptomatic. They are due for their 2nd dose soon. Is there any information that you are aware of about safety of receiving the 2nd dose of the vaccine if you caught the virus in between? He said he looked into it and found that it is okay to get the 2nd dose. I have warned him to be cautious and look into it some more, but it is not likely that he will. So it's interesting. I've heard quite a few people who have gotten COVID after the first vaccine. There's no data that says how efficacious the first dose is. So the 2nd dose we know is, well, supposedly efficacious, 95%. I question those numbers, and I come back to that if you want me to get into it, but I've gone into it a couple of times. But we know the efficacy, or we know the stated efficacy after 2 doses. They did not decide, they did not do any testing of COVID after the first dose. So they don't know how efficacious that first dose is. So people who are getting COVID after the first dose, it's not surprising because the first dose doesn't give you 100%, even the 2nd dose doesn't, but it doesn't give you as much antibodies as the 2nd dose after you get the 2nd dose. So these people are getting COVID because they would have gotten COVID even if they didn't get the vaccine because they were exposed to COVID. The question is how safe is it to get the 2nd dose if you've got COVID? The first thing is you don't need the 2nd dose if you've had COVID because you now have antibodies from COVID. And so you have natural antibodies. And so I don't know why you would go and get the 2nd dose, especially right then and there, because you just had COVID and your body has the antibodies. We know that people who have had COVID have the antibodies for somewhere at least 3 to 6 months. The projection right now is 6 months, but that's because they haven't tracked people who've had COVID more than 6 months because we only started proper testing or full testing in April, May, June. So, that's one reason not to get the 2nd dose. But the other more important reason that I would really caution this person about getting the 2nd dose is that we have no idea. There is absolutely no clinical evidence of what happens if you've had COVID, even if you had it and didn't have the vaccine at all. But if you've had COVID and you then get the vaccine, so what is that doing? If your immune system has already mounted a response to COVID, has built antibodies to COVID, what is the reaction your body then is going to have if you then put a COVID vaccine, which is mounting another antibody response to COVID. And what we saw in animals in the MERS and SARS trials, so this is, you know, many years ago when they were trying to develop a vaccine for MERS and SARS, was that people would, or that wasn't in people, it was in animals, sorry. The animals would have this increased response, and they actually died because their immune system just went into overdrive. And so immune activated response is the term for it. And so my concern, if I were this person, was, or anyone that's had COVID and that's going to get the COVID vaccine, is you have no idea what, if your body has mounted a response to this once, what's going to happen if your body, you know, gets this vaccine and is mounting another response to it. So that's the answer to that question. Oops. Next question. Sutter Health has required vaccines for all workers at their hospitals. There are many workers who are upset and don't want to do it. Do they have any rights or way to say no and still keep their job? So the answer is yes, I would just decline it. I mean, we're hearing all over the state. I mean, I think it was Riverside County, 60% of the healthcare staff won't take the vaccine. LA, it was 40%, 50%. So they have a right to say no. If the Sutter Health says it's required, then they should go for a religious exemption. And federal law does not allow discrimination. Now, Sutter Health may say, okay, you have to wear a mask, or you have to, you know, you can no longer, they have to make accommodations that are not discriminatory. So they can't say, oh, well, we're not putting you on any shifts then, because that is discrimination, and there are lesser accommodations that they could do, like wearing a mask. And my recommendation is, if there are many workers, that they need to band together and they need to go to their union. The unions are the ones that can speak up for them in this, and that will get them the opt-out for the vaccine. So those are my recommendations if you are in that process. Oops. Next question. Hi, thank you for all your work. I have read the COVID vaccine cannot be mandatory since it's not fully approved by the FDA and it was given emergency use authorization. The fast-track vaccines in the past have not been successful. So why are they pushing this vaccine that has been rolled out so quickly without any significant testing? The question whether an emergency use authorization vaccine can be mandated, it is not clear whether it can. My understanding is also that it cannot be mandated because it hasn't been fully approved. But again, we're talking mandated by the state or the federal government is different from being mandated to travel, to go into a store, to go into these societal mandates. So societal mandates are completely different, because you can be, you know, a private or corporation can make up whatever policies they want. You don't have to use that place. You don't have to travel on a certain airline if you don't want to. So those are different. So I don't think the state or the federal government can mandate a COVID vaccine at this point, but you know, corporations is different. You are correct. Fast-track vaccines have not been successful in the past. I actually can't find a single fast-track vaccine that has been successful and has not been pulled from market. But these have had a huge amount of money put against them. I mean, the other comment that I would make is 85% of clinical trials fail. And so of the 5 top vaccines that are coming out or that have come out, only one of them should succeed. So we're looking at this, and it's been fast-tracked. It's, you know, they shouldn't be succeeding, but because so much money is being pushed into them, there's really no way for them not to succeed. I said this when, you know, back in July, I made a video and I said, you know, you look at the billions of dollars that were put into Operation Warp Speed, and the federal government purchased millions of doses of each of these vaccines. Well, these vaccines were being made before any clinical trial had been, even in phase 3, had been put through. And so even started, not even, I mean, we still haven't finished them. We've got another 10 months to finish them, but they had bought millions of doses. They're not going to put those millions of doses in the trash. They're going to find use for them. So, you know, I think only time will tell whether this was a big mistake or not. And, you know, I mean, I will say from the other side of it, mRNA vaccines have not been ever clinically tested. These may be the answer to the future, to safer vaccines. They may. We have no idea. You know, I mean, there are definitely, there's technology that could make a safer vaccine and could make an immune response that is, you know, similar to getting the disease and without all the crap in them. Is this the answer? Who knows? We don't know. Nobody knows, because the clinical trials haven't been done, and they, you know, they still have a long time to happen. So next question. How can we protect ourselves and kids from 5G and Wi-Fi? Also, as far as water goes, is bottled water safe, and does it have fluoride in it? Okay, two completely separate questions. So I'll take the 5G and Wi-Fi first. So how can we protect ourselves and kids from 5G and Wi-Fi? So in your home, I would say get wired internet. So you can get fiber optic cable that comes into your house, and from there you can hardwire your whole house, and you can just use that. You have your, so that takes care of your computer in your home. Your phone, I would say, you know, most people have a smartphone. On those, it's incredibly hard to not get 5G, because if you're in a 5G area, it picks up 5G. So my recommendation is use your Wi-Fi over your data. So your Wi-Fi would be using your, and if you do have Wi-Fi in your house, usually most providers have a 2.4 gigahertz and a 5G gigahertz. So you want to keep it on your 2.4 gigahertz and use that on your phone rather than the 5G data that is from your phone provider. There are also things like smart meters. So there are many cities that now have smart meters. You can get a shield. It's like a wire cage that you can put over your smart meter so that the Wi-Fi doesn't go. You want to look where your smart meter is. Don't have beds near it. There are many other things that you can do. You can put your phone in a pouch that, you know, allows it to ring, but doesn't have the as much Wi-Fi coming in and out of it. In schools, it's a different story. So for schools, you need to lobby your school or your school district to use hardwired Wi-Fi as well, which is much harder because most of them have Wi-Fi and most of them have boosters, which boost the signal throughout the school. And so every classroom has Wi-Fi connection and those types of things. So it is harder there. The other thing that I would look for is the 5G containers, I'm going to say, are on electrical poles, so that you can see, if you see something that's about the size of a small refrigerator on a pole, that's your 5G Wi-Fi transmitter. And you want to stay as far away from those as possible. So if you have a house and you're looking at one of those out your window, you probably want to move, because there's nothing you can do to get it taken down. I mean, it's really hard to get them taken down once they're put up. If your city is planning on putting 5G in, make a stand against it initially and try and stop it. There's plenty of, as I said before, there are organizations that do this, that you know, try and stop it before it goes in, because once it's put in, it's close to impossible to get taken out. And the next one, as far as water, is bottled water safe, and does it have fluoride in it? So bottled water, I would say for the most part is safe if it's, you want mineral water, preferably to sort of reverse osmosis water. So for example, Aquafina, there's a Pepsi brand and a Coke brand, it's Aquafina, and I don't remember what the other one's called, but they are made from the water that is left over from making Coca-Cola. So the water they use, somewhere in the process, they have water left over, and they, you know, clean it, reverse osmosis it, and put it in a bottle. Those are not the healthiest water. If you're going for water, I would say get glass bottles, because then you're avoiding the plastic. But if you have to do plastic, one of the ones that Chris Exley recommends is Fiji water, because it has silica, but it basically removes aluminum from your body. And most bottled waters do not have fluoride in them. If you're concerned about fluoride and you have fluoride in your tap water, I would recommend getting either just for the water in your tap at your kitchen sink, a filter it needs to be reverse osmosis, or there are some filters. There are some countertop filters. Clearly filtered is one of them that is like a Brita filter, but it actually removes fluoride as well. Or you can get a whole house filter if you want your, your shower water and your bath water also to be, to have the fluoride removed. Okay, next question. Okay, next question. Are my children who have grandfathered medical exemptions allowed to transfer schools without triggering them from being required to send it to the state for approval? Yes. So if you're between grade spans, if you're between 1st grade and 6th grade, or if you're in preschool and you're changing preschools, if you're between 1st grade and 6th grade, or if you're between 8th grade and, or 7th, now I guess they're in 7th grade. So if you're in kindergarten this year and from 7th grade to 12th grade, this year going into the next school, that within that grade span, your medical exemption can be transferred, and it will not be, I mean, they may send it to the state, but it doesn't have to go in the immunization registry, and it doesn't, they can't say, no, it's not valid unless your doctor gets put on probation. That's the only time that they can say it's not valid. So yes, it can be grandfathered. Next question. Do you have any information about the pharmacist who left out vials deliberately? I do not, but I think it's very, very strange that he admitted doing it deliberately. I mean, if you're going to do it deliberately, do a better job, kind of thing. So no, I don't have any understanding of why he did it, and I have less understanding of why he admitted to doing it. Next question. What books or resources do you recommend for vaccines and overall health? I guess it depends on whether it's for yourself and whether you have an understanding, or whether you are, trying to open people's eyes. For vaccines, the ones that I like to share with people who are not sort of open to it, and or haven't done their research, basically, I like Neil Miller's Vaccine Safety Manual. I like that because it goes through each of the diseases and the vaccines and the pros and cons, and what the rate of disease was prior to the vaccine, those types of things. So I really like that one. I will plug our expo that we put on, or that I put on. It's called Live Aware Expo. And if you go to Live Aware Expo on YouTube, it has all of our presentations. And the first year that we did it in 2018, we did specifically, we looked at the diseases and the vaccine. So what's the risk of the disease and what's the risk, from the vaccine? And so I like, those are very specific. One of the things that I say to people is there's usually one disease that people are really, really scared of. So it's either measles or tetanus or polio. And so I say, okay, let's deal with that disease first for them, because the others will come. But for the disease that they fear the most, go and do a deep dive into that. And that's what that Live Aware Expo, and actually Neil Miller's book, the Vaccine Safety Manual, also does, is you can kind of do a deep dive on the disease that you're concerned about and see the issue there. Other resources for vaccines, I have a bunch of DVDs, Injecting Aluminum, The Greater Good, Vaxxed. Actually, I should say, all of these, if you go to a Voice for Choice advocacy.org/shop, or if you go onto the homepage, there's a shop or merchant. But we sell all of these, all of the ones that I recommend, we sell on our website, and those are really the books that I recommend. There are for overall health. I personally like Weston A. Price, and so some of Sally Fallon's books are really good. For children and raising children, Jennifer Margulis writes a book about how to raise a healthy baby. Trying to think what other ones that I know. And then there are specific, ones to 5G, or what we're doing to bees, pesticides, those types of things. All of those are on our website. So I recommend going there and having a look. And you're welcome to purchase them there or not, but those are the ones I recommend. And I will say, so the other one for people that have gotten into the vaccine issue and sort of want to go down the rabbit hole a bit more, Dissolving Illusions by Dr. Suzanne Humphries, I highly recommend. It's thick and it takes a lot of, dedication to read, but it's an amazing book, and it goes into the history of disease and how the whole story has been manipulated. Okay, next story. Next question, sorry. Is it true that a medical exemption will be invalid if the doctor who wrote it passed away? I was told by my son's high school that he wouldn't be able to transfer to a sister charter school because his doctor passed away. I'm in California. This is a huge question mark. And so if you need help with this, feel free to email me. We have been able to get children transferred and to have the medical exemption be valid because it was written at the time by a licensed physician. And because he died doesn't mean to say, I mean, if I have cancer and my physician dies, it doesn't mean my cancer goes away. That's one argument. The other argument is, if we're going to ask, if the school is saying that about your doctor, then they need to go through all the vaccination records, and any child that has had vaccinations from a doctor that died or is no longer licensed also needs to verify their vaccination status. And usually with either of those arguments, they kind of pull back and say, oh, okay, you know what, we're just going to not do this. So if you have specifically, if you need help with that, just email me. Anybody can email me. I think you all have my email address, but you can email me at christina@avoiceforchoice.org. Okay, next question. My chief concern is that we won't have access to learning about COVID vaccine side effects due to censorship. What would you recommend as strategies to stay on top of this? I agree with you, and I think it is going to be hard. It was interesting, they published the first 10 days, I want to say, maybe not even 10 days, maybe 8 days, of the vaccine reactions from VSafe, which is the tracking monitoring process. And they published the first however many days till I think it was the 15th of December. And then after that, they have not updated those numbers at all, which makes me wonder and makes me concerned with what they were showing, what it shows. We at Voice for Choice Advocacy have put in Freedom of Information Act requests for that data. I think it would be to their benefit that they make it transparent, but they clearly aren't. So we're hoping to get it. I think there's more likelihood of us getting the VSafe data from a Freedom of Information Act request than there is regular vaccine data, just because it's not, it's owned by the CDC, and so they basically, under the Freedom of Information Act, they have to release it, but we'll see. Okay. Next question is, next question. What do you know about requiring vaccines when going through the immigration process in the US, i.e. will you be required to vaccinate to get a green card? So no, there is a religious exemption process that you can go through, and you're not required to vaccinate. You can email me, or the other person that has a very high success record with this is Alan Phillips, who was a lawyer in North Carolina, and his specialty is this. But feel free to email me separately, and I can help you out and I give you his information. Okay, next question. If you have to get the COVID shot to travel and you become ill with the reaction, hospitalized, or would need to be flown home, do you know who pays for that? I can't imagine travel health insurance companies getting on board with this. Thank you. My guess is you would go to the compensation program, but I don't really know. My guess is also that nobody's going to pay for it. You're going to end up paying for it. I don't think there are health or travel insurance may, because you got sick. It depends on the language in the insurance and what is covered, but the manufacturers and the doctors are not liable, so you can't go to them. And the question becomes, and we ran across this with the school vaccination issue, the question becomes, if a school mandates the vaccine, or if the government mandates a vaccine to be required for school, can you sue the school if you have a reaction? Can you sue the state if you have a reaction? And the answer I've gotten is it would be very hard to. So but I don't think it has been, I don't think it has gone that far, but my thought is that you would go to the compensation program and they would cover your compensation for the reaction and whatever, hospitalization or whatever is included in that. I work for a school in Colorado where my children attend. My job is currently remote and could feasibly remain remote. We currently still have a personal belief exemption, but they are moving to require a conversation with the doctor to get educated before allowing an exemption, much like California before SB 277. If school workers are part of the Tier 2 group, how can I decline and keep my job? So I answered this already. You can just say no is the first thing that I would do. And if they require it for you to keep your job, I would recommend doing a religious exemption. Next question. Thank you for your service. You're welcome. Where would we find specific various texts in the Bible that you said you shouldn't have a vaccine? You email me. I can help you with those. I have religious texts from various religious texts, so from the books and stuff like that. So depending on your religion, I can help you with that. And the reason why, I should say, the reason why we don't put that up on our website is because, as I said, everybody's religion is different to themselves, and we also don't want to be targeted, and that to be the reason for religious exemptions to be targeted. And so we sort of, it's not illegal in any way, but we just don't advertise it and publish it anywhere. Next question. My question pertains to my 2-year-old son. He has a medical exemption to vaccines prior to SB 276. I know that the new law overrides medical exemptions, but had language about grade levels. We were wondering when our son will no longer be able to attend daycare. So your son, if he has a medical exemption on file currently, he will be able to go until TK or kindergarten, whichever one he gets to. If he's eligible for TK and goes to TK, it would be TK. If he's eligible and goes to just kindergarten, it would be kindergarten. Next question. For COVID testing special needs kids who cannot spit, is there a test to rub in the mouth by cheeks you recommend? I have not found I know there is one that there's a saliva test, but I don't know of one that's easily accessible without a doctor or that is widely used. So I think you'd have to go looking for it. I probably could look for it and see which one it is. And if there is, I'm pretty sure there is one that you can use a swab inside your mouth, in your cheeks, but I have not, don't know the name of it, and I don't know it. So it's something that I will follow up, and I can let you know. Okay, next question. I'm an elementary teacher in California. Are they going to force me to do the COVID vaccine? As I said, I don't believe so. Decline it, get a religious exemption if they do. Okay, next question. In California, the Health and Safety Code and Education Code operate under a special definition of state, which narrows the political jurisdiction to only the aspects of the state where the federal government jurisdiction is dominant. There is a law teacher from Stanford that says there are political aspects to the jurisdiction of the state that are exclusive to California, so not subject to the jurisdiction of the United States. Have you seen any work done to see if one could avoid HSC and thus vaccination laws by limiting one's presence to be within the aspect of California that is foreign to the United States and thus foreign to the Health and Safety Code? So my answer to this, and people, there are a lot of people in California that, and in the US that say, well, we fall under natural law, we fall under the constitutional law is different, and this, that, and the other. Ultimately, for the California Health and Safety Code, if you need let's take the vaccine law for kids, the schools are going to put in place the law that they have been told to execute. And so to be able to say, well, I don't agree with that law, that's not how our laws work. This is how our laws work, and this is how they should work. This is our Constitution. This is the special definition. This is blah, blah, blah. It's all very well and good, but honestly, The schools are just doing what they're told to do. And so are you going to get anywhere with it? Are you going to get anywhere with it with your employer? No, not really. Are you going to get it anywhere in a court of law? No, because the court of law is going by the laws of the state. And so, you know, I have yet to see this argument play out in a way that actually, you know, stands up to anything. So if they do it, I'm not saying that it's not correct and accurate, but if you know, I just haven't seen it play out. And if it does at some point, fabulous, you know, go for it. But I just don't see it. I don't see it playing out on a practical level. Okay, next question. Do you recommend nebulizing colloidal silver to prevent, treat COVID? So I'm not a doctor. I should have said that at the beginning. I should have given my disclaimer. I'm not a doctor. I am not a lawyer. I am just somebody who reads and reads and reads and listens and listens and listens to all sides of the story. So I can't give you a recommendation of what to do. I do think colloidal silver, I think hydrogen peroxide nebulizing, you know, there are protocols out there from doctors that include those things, and they have had very high success rates. So I would go with what a doctor is recommending, not what I'm recommending. Okay, next question. Sorry, will you please elaborate on the vaccine mandate that is in place in California? Does this mean we will be forced to get vaccines if the government deems necessary? Okay, so you're referring back to AB 262, and the language specifically states that the local health officer, which is usually a county health officer, there are 3 cities in California that have their own health officers, but the county health officers, or those city health officers, can take any action they deem necessary in the time of an epidemic or a potential epidemic, which means that they literally can make you do anything they want. They can lock down, they can quarantine, they can make you get vaccinated, they can get you tested, they can basically deem anything they feel is necessary. They can deem that what needs to happen. So could they mandate the vaccine? They could put a county mandate. For example, we had a county flu mandate in, I think it's 8 counties have a flu mandate. Most counties have a flu or mask mandate. So for healthcare workers, this is specifically. So for healthcare workers, you either had to get the flu vaccine or use a mask for the flu season. And the 8 counties, I think it was, changed that into a mandate that all healthcare workers have to have the flu and you can't use a mask as an alternative. We wrote letters, a Voice for Choice Advocacy wrote letters to all of those counties and got them to include that there should be a religious exemption, and at the very least, either the people should be able to, the healthcare workers should be able to decline the vaccine or have a religious exemption to not get the vaccine, and we were successful in that. So I think the local health officer could mandate the COVID vaccine. I think they would most likely do it in a very targeted fashion. So for example, for healthcare workers or for the elderly or for people in certain, you know, priorities. I don't think they're going to do it soon because there aren't enough vaccines. I mean, there are too many people that want the vaccine for the number of vaccines there are right now. And we have to give a second dose, or they have to give a second dose of the vaccine to all of those people. So right now we're not in a position for them to mandate it. Could they do it in the future? Yes, they could do it in the future. I think there's a lot of pushback and I just don't see it happening. I think that would really be the straw on the camel's back for people. And I think we would have a lot of people reacting to that and complaining about it. Okay, next question. My husband and I would like to adopt or foster children, but the agency says we need to vaccinate children in our care. Okay, so 2 different issues, adoption and foster care. So for foster care, you do have to vaccinate the children. That's part of the deal. If you're going to adopt a child, it really depends on the adoption process. So if you're doing it through the state, they will require vaccination up to the day that you adopt the child. If you do a private adoption where you know the mother who's having the child, and you do it between the 2 of you, you can say to her, you know, we don't want to vaccinate, or just say we want to vaccinate with our pediatrician at a later date, then you can do it. But for foster care, you have to, and for state adoptions or closed adoptions or a point where the adoption isn't final on the date of birth. So there are some adoptions that you can do that are pre-birth adoptions. So you actually adopt the child prior to the birth of the child. And then once the child is born, they are yours. You've already adopted them. So that's that answer. Next question. I understand that there is now policy allowing 11-year-old children to consent to vaccines without parental knowledge or consent, and that this treatment would be legally left out of a child's medical records. Is your organization already fighting this? It's hard for me to understand why any parent would be okay with this. So this was a law that went into, actually it hasn't gone into place yet. It needs to be ratified by the Washington, D.C. So it's happening in Washington, D.C. I'll get back to California, but in Washington, D.C., they passed a law, and it said that 11-year-old children or above 11-year-old children could agree to vaccinations, and you're correct, it would not be shown on their medical records, and so parents wouldn't have any knowledge of it if the child didn't say anything to them about it. It was not signed or vetoed by I believe it's the mayor, who's the sort of signer of that, because they don't have a governor. And it was not signed or vetoed, which means it by default becomes law. It doesn't need her signature. It doesn't need if it had a veto, then it would not become law. But it does have to go through one more step where it has to be ratified by somebody, or I think it's a council or something. But anyway, this policy is in place, or will be in place most likely. I don't understand why any parent would be for it either. It also calls into question, if 12-year-olds are allowed to consent to a medical treatment, why wouldn't they be able to consent to a lot more, which you wouldn't, these same people wouldn't allow it. Coming back to California, California already has a law on the books. It was AB 499 that was passed in 2013. And it allows 12-year-olds and above to consent to anything related to sexually transmitted diseases. So your 12-year-old child and above can go get an abortion without your knowledge. Your 12-year-old and above, the way it comes into vaccines is they can get STD vaccines themselves. So they can get the hepatitis B vaccine and the Gardasil vaccines without your knowledge. So we do have a law similar to that already in California. It's not as extensive in that it doesn't, it's not all vaccines, but it is, we do have a similar law here already that allows them to consent to any sexually transmitted disease treatment or prophylactic. So they can also get the pill and stuff like that. Okay, next question. Would you please tell us more about the claimed 95% efficacy rate on the COVID vaccine? Yes, so the way both trials, both Moderna and Pfizer, the way the trials worked were there were either 15,000 or 20,000 in each arm. So in the placebo arm and in the COVID vaccine arm, there were tens of thousands of people in the study. The way they came to the FDA emergency use authorization application process, so they could submit for an emergency use authorization when they had somewhere around 150 to 200 people that had gotten COVID. Not whether they've been in the placebo and the control group, but just 200 people out of the 30 or 40,000 people that got COVID. They then unblinded those 200 people, and they found that 95% of them, so I think in the Moderna trial, it was like 150 of them or 160 of them were given the placebo, and 20 of them were given the vaccine. And so you divide those two numbers by each other and you get 95% efficacy. So 95% of the people who got COVID out of the people who got COVID were in the placebo group versus the control group. Now, the issue with that is, sounds great. The issue with that is it only went to 200 people getting COVID. So that's a very small number. And furthermore, if you actually take the real numbers, which is there are 170 people out of 20,000 people who got COVID in the placebo group, and there were 20 people out of the 20,000 people who got COVID in the vaccine group. Both of those numbers are minuscule. So even the 170 out of 20,000 is 0.00 something percent. So I personally will take the efficacy of the placebo, which is 99.9 something percent, over the vaccine, because they both basically have the same efficacy. Problem is because the clinical trials haven't gone on for long enough, we can't tell how many people are going to get COVID in either arm. You need 12 months. You need these people to be exposed to COVID in order to determine the rate of efficacy, and that didn't happen. Next question. Can you please educate a bit on CARE database? And is there any indication that the database and software for 276 mandates is actually in place? Good question. So the CARE database is the California Immunization Registry. If your child or you have had a vaccination, most likely, especially if you've had it in a large hospital type setting, healthcare setting, so if you've had it at, in Kaiser or somewhere like that, or if you have had it at a pharmacy, most likely your vaccine information that you've had that vaccine has been put into the CARE database. The CARE database spans California, but there are 2 regions that have held out being in the state database. So the San Diego region and the San Joaquin, so the Sacramento, the San Joaquin, Sacramento area has also held out. And they are actually not integrated into the CARE database. They have their own separate database. And that stems from the fact that many, many years ago, California, every county in California, or every region maybe it was, had their own immunization registry. And at some point they came together and wanted to create one registry, and all the other states or the other counties basically put their information into the CARE database, but San Diego and Sacramento or San Joaquin have a more advanced database. So they have much more information in their database, and they didn't want to downgrade to the CARE database. So it's actually 3 databases, and they don't really interact with one another. They've been saying for years that they want to create one database, but it hasn't happened yet. That's a little bit of history there. I have not seen anything, and it only went into place January 1st. They were supposed to have the forms available to physicians to write medical exemptions. I have not seen any evidence that the medical exemption form has been created. So I haven't seen anything, and we're pretty well connected with doctors, with CDPH, with all of those things. But I have not seen anything that says that it has been done. The other piece with the CARE database, with the California Immunization Registry, is you cannot remove your information from that database, but you can lock it. So you can go onto their website and you can fill out a form that basically locks your information or your child's information. And what that does, it does not remove the information from the database. It just means that, for example, schools can query your child's immunization status, and it means that your school cannot look your child up. It'll just come back and say, sorry, this information is not available. But people like CDPH, who have higher authorization into the database, could still see your child's vaccine records. Next question. Is there any evidence of viral shedding transmission among those vaccinated? So viral shedding and transmission, I'm going to take, they're one and the same, but they're different as well. So viral shedding, I have not seen any evidence of viral shedding, although I question it, because the people that are getting the vaccine, especially the second dose, have said that they feel like they have COVID symptoms. And so the question is the body generating those symptoms without any shedding, or does it have shedding? And I don't think there's any, it's not that I don't think, there is no evidence one way or another of that. And I think the vaccine manufacturers would say it can't do that because it's not a live vaccine. but I would question it. I don't think there's any evidence. From a transmission point of, if you get the vaccine and you are exposed to COVID, there is a thought that for at least the mRNA vaccines, that you can still have the COVID disease in you and pass it on. And we see that with the whooping cough vaccine that happens with pertussis, where you can have the vaccine, you can show no symptoms, but you can still transmit it. And it's the reason why they're saying, you know, masks aren't going away. If you get the vaccine, you still have to wear a mask because you could still transmit COVID. Okay, next question. I'm just looking at the time. We have about half an hour and we have 18 questions. So I'm going to rush through it and see if we can get through them all. In response to your statement, in response to your statement that California already allows the DHP to order COVID vaccines, there are thousands, even millions of us who have no interest in getting it. What are we to do about this? Will those who have an allergic background be exempted medically automatically? So the answer is talk to people. Rally with the people that don't want it. There are enough people that don't want this vaccine, or at least don't want the first vaccine, don't want to be first in line. And so those are the people that we have to, you know, we have to have conversations with, we have to talk to, we have to help them understand why their feeling of not wanting to get the vaccine is a correct feeling, and that they should be concerned because there aren't any clinical trials that have been completed. This is new technology, never used before in humans, never tested before fully in humans. You know, there are many, many reasons. And so, you know, getting those people that are questioning this, which is, as I said, you know, it's about 50%, keeping them close kind of thing, and ensuring that, you know, they do understand why they're saying no. As for those who have allergic backgrounds being exempted medically automatically, nothing's automatic. You would have to get a doctor to say, yes, you are exempt. I think if you have an EpiPen, you know, that type of allergic reaction, you're more likely to. But we've seen, you know, healthcare workers go in and get their COVID vaccine and have their EpiPen ready, and they're willing to take that risk. So, you know, vaccines are a strange thing, and they, you know, bring out the worst in people on many fronts. Next question. What are the age groups in the vaccine trials? Did you say there are no children included? Correct. In the current vaccine trials, there are no children included. The Pfizer vaccine included 15, 16, and 17-year-olds in their trials. And so the Moderna vaccine was just 18 and above. The AstraZeneca vaccine, which is the next one, is also 18 and above. I believe the J&J vaccine, which is the fourth one that's likely to come out, they have been enrolling some children in it, but that's the only one that has children right now. I do believe that Pfizer is looking to add children to their clinical trials, so they will be doing so in the future, but they have not yet. Okay, next. What was the placebo on the Moderna one? It was a saline solution. Next question. Clinical trials were done last spring and summer in Shanghai or Wuhan on a high-dose IV vitamin C treatment for COVID patients after discovering that they could save COVID patients this way last spring. Have you heard anything about this? It's Dr. Richard Chen, a doctor in both the US and China, who's been reporting on this. He's got a YouTube presentation. I have watched it, and I believe there is a trial here in the US happening as well for that. I don't believe there are results for it yet, and my guess is when the results do come out, if they're favorable, they will be censored and pushed down, because it is not the treatment that they want to show as being one, because it's cheap. Can you give an overview on how the COVID vaccines work, or point me in some good resources where I can study this? Thanks. So the COVID vaccines, the 4 front runners that I just mentioned, they use different technology. The first 2, the Pfizer vaccine and the Moderna vaccine, use mRNA messenger technology, which is new technology. And the AstraZeneca vaccine, which is the next one that will be approved, it was approved in the UK this week, is a adrenovirus vector vaccine, also has never been used and never been tested on humans. And the last one is a J&J vaccine, which has been, which is based off existing vaccine technology that has, I don't remember which vaccine it is, but it has been approved maybe the Ebola vaccine, but it has been approved here in the US and in Europe and the rest of the world. Those basically are the overall, the mRNA, I'll go into a little bit of detail, but if you just, I'm trying to think what sites are good, but if you just Google, or not Google, but whatever you do, search for those specific technologies, you'll get you can get a very bland scientific overview of what they are. The mRNA vaccines basically are a protein spike that they put into this messenger DNA, and it activates the immune system and your DNA RNA that then replicates. And it replicates and replicates and replicates these proteins. And so that when you get the COVID, but if you're exposed to COVID, then your body has this immune response already in it. The adrenovirus vector vaccine is a monkey coronavirus that they're using, and they have implanted into the monkey coronavirus the genetics from COVID-19. And it's the reason it is not as efficacious, because people have already basically they don't generate antibodies to the coronavirus, the monkey coronavirus, because they may have already had a similar coronavirus, a human coronavirus to that monkey coronavirus. Some people have. And then the J&J vaccine is based off of a Jensen proprietary technique. So I would look up, I don't think there's any one place that has an overview, really good overview of any of those, but you can, if you look up each of the technologies or each of the vaccines, I'm sure you can find something. Next question. Can we argue that we prefer to strengthen our immune system through good diet, vitamin C, D, zinc, etc., instead of the vaccine? You can definitely argue that. I don't know to who. If it's to say to your employer, I want to do this instead of the vaccine, no, if they're going to require the vaccine, they're going to require the vaccine. They're, if they're in that mindset, then they're not going to think vitamin C, D, and zinc is going to do anything. For you personally, can you do it? Absolutely. But it kind of is a different issue. Next question. Are people recovering from the Bell's palsy reaction? From what I understand, for the most part, yes, but it takes time to recover from Bell's palsy. So it's definitely not an immediate, and I do believe they have treatments for Bell's palsy that helps with that, drugs. So I'm sure they're being put on those drugs, and, it's the pharmaceutical industry, so I'm sure they're doing something for them. But my understanding is that I do believe that those people that got it, at least in the clinical trials, did recover from it to some extent. I don't know whether that's fully or not. It's not clear. Okay, next question. Community guidelines is stated as the reason why we cannot discuss natural immune boosting online sites. It's very frustrating. I think it's section 230 that allows sites to edit as they wish. Finally, I just said, message me if you want to hear about natural boosting, and that way I'm able to reach inquiring folks. This is a comment for your session participants. Oh, okay, thank you. Yeah, there's censorship all over the place. It's, it means that you can't, we post on Facebook, we post on Twitter, but, and we do it carefully in a way that we haven't yet been banned, but I'm waiting for the day. But, if you use other platforms such as Telegram or Parler or those types, it's becoming much more decentralized in where to post things, that you can still get it done on other platforms. Okay, question. If the doctor who issued my child's medical exemption goes under review by the medical board, how will the school be notified? Is there any chance that they will fly under the radar? So if your doctor goes under review, nothing happens. It's only once there is a determination of whether they, did something wrong. So if they're put on probation or if they are suspended, at that point, the school may be notified. The way that the schools have been doing it for the most part is they go onto the medical board. When they get a medical exemption, they go onto the medical board site, look up the license for that doctor and see if that license has been suspended or put on probation. I will say that I do think there are certain counties, San Diego is one of them, probably the worst at this, that have basically sent letters to schools saying, if you have any medical exemptions from this doctor, they are no longer valid and you need to contact the parent. Or they have requested to see all medical exemptions from the school. And so they have been pushed to the local health department, and they have been then getting back in contact with the school and saying, this one's not valid, this one's not valid, this one's not valid. So is there a chance they'll fly under the radar? There is. I mean, if your school is not on top of it, or is, feeling that this is a little much, there is a chance that you could fly under the radar, but there's no guarantee to it. Okay, next question. How do you get removed from the care database? My unvaccinated children are in it and my doctor does not know how to get me out. It's just the system that they use. There's no way to get you out of the system. You can lock it, as I said, but once you're in the care database, there's no way to get you out of the care database. I'm surprised if they're unvaccinated that they're in it, because you usually are not in it until the first vaccine is given. If I were you, I would actually have your doctor pull what information is in there. I will say that I saw a post recently. It was on some California, I don't remember what it was, but some California presentation, and the woman showed the numbers for the care database, and it showed that 106% of Californians are in the care database, which, if you think about, is absolutely ridiculous and crazy. And the reason for it is it keeps everyone in it, even if you move out of California. There are, I'm sure, duplicates that if you went to a pharmacy and they didn't check, and they then put your child's name in, with an incorrect spelling, or with a middle name or something like that, that they're in there twice. So I'm sure, but the care database is just, from that, and from what I know, I'm pretty sure it's a big mess and it doesn't really have very accurate information in it. But I don't think there is a way for you to get out of it once you're in it. Okay, next question. What year was CARE created? Can I expect to find records from 2007? I don't know what year it was created, but I'm pretty sure it was there in 2007. There was a grant, there was a federal grant from the CDC that was given to every state that applied, or was available for every state that wanted it, to create an immunization registry. And I'm pretty sure California was one of the first, was in there in the first to get it. I don't remember what year it was actually created. I have the history of it because I went down that rabbit hole at some point. So if you really need to know, I would look. The key is that doctors weren't necessarily using it initially. So you have to, if you're a doctor, you have to be signed up for, being able to, and do training, and you have to pay money to be able to input information into the care database. So if you're with a small, pediatric group, or a small, an individual physician, they wouldn't use CARE. But if you're with Kaiser or one of the big hospitals, the big entities in California, or if you are, if you go to the pharmacy or something like that, then you would have records in it. Okay, next question. Do you think recalling Governor Newsom through Recall 2020 petition would be helpful for preventing mandatory COVID vaccines and getting current vaccination legislation overturned? The biggest question of that is who replaces Newsom if his recall is successful. So there are various steps of recalling him. The first one is to get the signatures in order to recall him, to have a recall runoff. So then you have Newsom versus whoever the person is that is chosen to be in the runoff. There are many issues to recalling a legislature. One of them is that at that point, Newsom can raise as much money as he wants for his recall effort, but his opponent is restricted to the campaign money limits. So it's very unfair. The other thing is, if you look at Newsom's approval ratings in California, unfortunately, they're still at like 60%. So the question is, who's running against him, and can the person running against him actually win against him? And, you know, I hate to be a downer, but it has to be a Democrat, because a Republican is not going to win against Newsom, or it's going to be incredibly hard for him or her to win against Newsom, just because of our voter registration. You know, our voter registration in California is 65% Democrat, 35% or, you know, Republican, and there are independents in there, don't get me wrong, but if you look at the two parties, it is so much higher Democrat. And, you know, I think it's going to be incredibly hard for this person running against Newsom to actually win. So it has to be somebody that has a lot of following already. And unfortunately, I think that has to be a Democrat, not that that's what I want. So then the question becomes, if it is a Democrat, you know, that mandatory COVID vaccination is, you know, a part of their platform, unfortunately. So, or not COVID, but mandatory vaccination for school children is part of their you know, sort of their ingrained platform. And so it's really hard. Getting the current vaccine legislation overturned has to go through the legislature, and for that to happen, we have to get rid of Senator Pan and Assemblymember Gonzalez, and they are terming out in 2022. So at that point in 2023 is when we feel that we could get vaccination legislation, even just start having the conversation of getting it overturned. Doesn't mean to say I should go back to the recall Gavin Newsom. It doesn't mean to say that I don't think we should try and recall him. So don't get me wrong there. I'm not saying that it's not worth doing. I just think it is incredibly hard, especially when it comes to the vaccine issue. Next question. The CARE site lists an email for schools to send in a medical exemption. Should we do an affidavit? What's the way to handle this? Thanks so much. So yes, so the CARE site, schools have been, and there's a interesting dynamic here. So some counties, I will look to San Diego because they seem to be the best at implementing all of this, have said that you have to send the medical exemptions to the CARE site prior to 2021. The answer is they do not. And if you have a grandfathered vaccination medical exemption, our recommendation is to put a disclosure in with it that states that you do not want that information, that it's medical information, and you do not want that shared with anyone. We have that on our A Voice for Choice Advocacy website under issues, school vaccination exemptions or medical exemption, something like that. If you can't find it, just email me and I'll send it to you. But we recommend putting that in with your medical exemption that's grandfathered and is at your school, and that way hopefully it won't get sent in. For medical exemptions that are put in this year, 2021 onwards, new medical exemptions, they actually have to be filled out by the doctor, and the doctor submits them to CARE on a specific form, and that's how they get sent in. And then you get a copy of that to, you know, print it out to take to the school and give it to the school. So it's a different system. I think the CARE site listing an email for schools to send the medical exemption, that's not in any laws, in any regulations anywhere. That's not how it's supposed to work. So if your school's doing that, I would call them out on it. All right, next question. Christina, thanks for your time. You're welcome. I can dedicate 5 hours a week for activism for this cause and attempt to get more Republicans in office. How do you recommend I spend that time? So I don't know if that's two separate questions or one together. So I will say A Voice for Choice Advocacy has a load of projects that we would love your volunteer help. So if anyone on this call or listening to this afterward wants to help, wants to volunteer, the one thing I ask for is that if you commit to volunteering, that you actually do it, and keep up your commitment, and don't say, oh, I thought I was going to be able to do it and I couldn't do it, because there are other people that are willing to do it. So we would love your time, and if you want to do it, please do email me and just say that you want to volunteer, and if you want to volunteer, what you're good at, so what you enjoy doing, what you want to do. As for to attempt to get more Republicans in office, so we can't do that for another 2 years. 2 years' time is the next election. The problem with California is, and I assume you're talking state level, the problem with California is California had a voter initiative maybe 10 years ago, maybe a little bit more, that puts the top 2 people in the primary in the general election. So most states, every other state has, and it used to be like this in California, has that Republicans, or it's a 2-party runoff in the primary, and whatever the 2 parties are that get the most votes, those 2 people that get the most votes for those 2 parties are the ones that go into the general election. The way California now works is that the top 2 people who get the highest votes go into the general election. And what that means is that, for example, if you have 5 Democrats running against 1 Republican, those 5 Democrats actually may get less votes than the 1 Republican. But it also means that you're likely to get 2 Democrats running off against each other in various races. And so it's really, really hard to get a Republican in office in a non-Republican, non-heavy Republican district. The other piece of it is that unfortunately California is getting more and more blue, because the people who are not blue, who are Republican or just not blue, are leaving the state and going to other states because they've had enough of California. So it is, if you are interested in the election piece of it, because of Voice for Choice Advocacy, cannot deal with election stuff. I created with a group of other people, California Families for Health Rights, and you can go to that, it's California Families, CAFamiliesforHealthRights.org. And that sort of, there's still old election stuff from this year, but it sort of goes through, and we're happy to have you, if you are interested in that, we have a group that we got together with CPOC, PAC, and a few other people that were interested in the elections, and we kind of worked on different elections and found the races that actually had a chance of winning. And so there is strategy there. It's just getting Republicans in office in California is much harder than doing it in a different state. Not to be a downer on this, but it's just reality. Okay, next question. Do you think if we lock our record in care that it will trigger raising of a red flag? Hard to answer, I'm sure, but would love your insight. I don't think it will. I don't think it will, because I think there are enough people in California that are privacy oriented, that are completely outside the vaccine issue. So I don't think so. Are they looking for it? Maybe. I mean, who knows these days? I mean, I'm sure there are people in CDPH that would like to look at that information, whether they are or not. I don't know. Next question. What is the difference between the vaccine technologies used by the different companies, Mrna, J&J, etc.? Is one safer than the other? So as I went through, if you want to know about the technologies, go back and listen to the earlier question. But is one safer than the other? We don't know. We have no idea, because the clinical trials have not been done on these vaccines. We're 2 months, 3 months into the phase 3 clinical trials, the large scale clinical trials. So we have absolutely no idea which one is safer. The Moderna, the Pfizer, which are the mRNA vaccines, the AstraZeneca Oxford, which is the adenovirus vector vaccine, those have never been tested fully on humans. So we have really no idea. The J&J vaccine has been used in other vaccines. The technology has been used in at least one other vaccine. So it at least has some safety profile to it, but different diseases, viruses may react differently. So my suggestion to people is, why are you running to get the first vaccine? That's the one that was rushed the most. So the 2 that are out right now are the ones that were rushed the most. So why would you get one of those 2 vaccines? Why wouldn't you wait and see? I mean, it's interesting because most other vaccines, if you take the measles, mumps, rubella vaccine, there's only one MMR vaccine that you can get from Merck. Most other vaccines have only one vaccine, maybe 2. There are a few that have 3 or 4, like the flu vaccine has more than one, but they're usually specified for certain age groups. With this COVID vaccine, there are 200 COVID vaccines in the pipeline, but there are 5 that are going to 4 or 5 that are going to be out by, you know, March, April, May. And so, you know, to me, I mean, I'm not going to get the vaccine, but if I had to get the vaccine, or I was considering getting the vaccine, I really wanted to get the vaccine, I certainly wouldn't rush and get the first vaccine, especially if when the clinical trials haven't happened. Okay. Next question. How can we find out if our 5G transmitters will be installed in our neighborhood? You want to go to your local city council meetings or look at their agendas, and they have them on it. So it's your local city council that implements it. They also usually they'll put up signs where they're going to put the transmitters up for public meetings on 5G being put up, but it's your local city council that does it. Okay, next question. Does either the Pfizer or Moderna COVID vaccine give a person immunity? Supposedly it does, but you know, I answered that question as well. The efficacy is supposedly there, but I would say it's too soon to really know the answer to that, because I don't think enough people have been exposed to COVID, the virus, that have been given the vaccine. I understand that private employers can mandate vaccines, but how are they not liable for injury that it may occur? Why would it not go to workers' comp? It could go to workers' comp. I just don't think they actually have, I don't think anyone has gone through the whole process of it. So I do think it could go to workers' comp. It really depends on how you're injured or how badly you're injured. And do I think they're liable? I think, again, I don't think the answer is there. Do I think there is a lawsuit waiting to happen? Absolutely, 100%. Can I tell you what the outcome of that lawsuit is? I can't. I don't think anyone can, because I don't think there's been a lawsuit that has been specific to that. Next question. My daughter has an IEP and an ME when she goes to middle school. How should I approach the school district if they require vaccination? So if you have an IEP, you are not required to vaccinate. That trumps your medical exemption. And you know, that's what, if you know your daughter is going to have that IEP for the rest of her school time, I would just rely on that, because that's a federal issue and federal trumps state. If you have any issues with that, again, I would recommend Educate Advocate, amazing organization, educateadvocateca.com. Talk to them or email them, and they can help you if you have any issues. But you should just be able to tell your middle school that she has an IEP and therefore vaccines aren't required. Next question. Of the True 47 masks, are all of them good? There are many different styles. So yes, so are all of them good? Yes, I think so. The one I would recommend is the silver mesh mask. It comes in either a cup or a pleated style. I personally like the cup style more. I don't particularly care for the pleated one. Is like a surgical mask that kind of opens up. I don't particularly care for them, but different people have different opinions on that. But the mesh mask is the one that's breathable. They do have a copper mask that has silver mesh on the inside and copper on the outside. It is much denser and like a normal mask to breathe through, but it does have, copper is anti, I don't know whether it's microbial or viral or both, or which one, but it has an extra layer of basically killing the germs. But for me, one of my pieces is I cannot breathe properly in regular masks, and I find it stifling. And so the mesh mask is very, very breathable. And the other piece to me is that I don't want to be breathing back in what came out of me. And so because it's made of silver, it kills that stuff. And so that is the one that I would recommend of their masks. That's my personal favorite. So there is a 5G map online. Oh, wonderful. If you have the link to that, feel free to post it in the chat. But I was not aware there's a 5G map down to I didn't realize. So what I think people are looking for is the 5G, the cities and who have 5G and don't have 5G yet. So if that is available, definitely, if you could email it to me, that would be fabulous too. And the very last question, and we are at 8:56, this is perfect. Both my kids have a medical exemption. Does it mean we are exempt too? I'm not sure who you mean. If you mean yourself, no, you would have to have a medical exemption. If you mean that, does their medical exemption cover COVID vaccine, there are two issues there. It depends on how the medical exemption will be used and what the legislature says. If you can use your old grandfathered medical exemption, then there's a possibility, but we don't know. And the last person gave me a comment, which is copper is effective as a disinfectant as well. So yes, I knew there was some extra benefit to copper on there. So those are all the questions. Yay, we got through them today. Thank you so much, everyone, for being on here and for asking your questions, because I got to answer them. I will say, if you people ask, what can we do? And so just to finish up, what can you do? There are 3 things that I ask you to do. Number 1 is open your mouth and talk to people about these vaccines, because get yourself educated even on, the most basic level on these vaccines. And we will be putting out in the next week a flyer on talking points for the COVID vaccines, so that you can take them, you can give them out, just to get people thinking and really understanding what they're doing if they're contemplating getting these vaccines. But we have an opportunity here that we would never have had before COVID, because so many people are questioning these vaccines, and the vaccine process has been so transparent. So my first ask is just open your mouth and talk. Don't be scared to talk. Just educate people and get them, even if you just get them thinking. You don't have to convince them not to take the vaccine. You have to convince them to get informed and make an informed decision rather than a blind decision. The second option is, I mentioned earlier, if you want to volunteer for Voice for Choice Advocacy, we always have things for people to do. I will be sending out an email next week with information for those people who have signed up. If you've already signed up, thank you, thank you, thank you. And the last option is, I do this without being paid. I don't take any money from a Voice for Choice Advocacy or a Voice for Choice. I do it all out of passion and out of love for this cause. But we do have a lot of expenses. We have 2 lobbyists hired in Sacramento to make a difference there, and to work on and being seen as a professional organization, so that in 2 years' time we can do something more about the vaccine issue once Senator Penn and Assemblymember Gonzalez are out of office. But we also have other things. Education. We're launching a big, and as I said, get on our newsletter, but we're launching a big action plan in the next 2 weeks to really go more on a local level. So Board of Supervisors, school district level of things. And that, it doesn't cost a lot of money, but it does cost money to set up websites, platforms, because we aren't, we no longer are willing to use or can use the social media platforms. And so we're actually creating a platform specific to advocacy in California on the county level. And so, things like that, they do cost money. So I ask for donations for a Voice for Choice Advocacy. If you don't need a tax deduction, then a Voice for Choice Advocacy. If you need a tax deduction, if you're giving a larger amount or want a tax deduction, you can give to a Voice for Choice, which is our sister organization that does a lot of the education piece of it. So thank you so much, and have a wonderful evening. And you can re-watch this recording. I'll post it tomorrow. Thanks so much. Take care. Bye-bye.